Atherosclerosis, understanding the process and taking control. Atherosclerosis, a pervasive cardiovascular condition, involves the accumulation of cholesterol plaques within arteries, posing a significant threat to vital organs such as the heart, brain, and intestines. This insidious process results in the narrowing of arteries, thereby restricting blood flow and oxygen supply. The consequences can be severe, ranging from chest pain and organ damage to life-threatening events like heart attacks and strokes. As a seasoned professor in the field of medical sciences, I have dedicated my career to unraveling the complexities of atherosclerosis and guiding numerous students toward a comprehensive understanding of this condition. With over 1,000 successful graduates, I recognize the critical role education plays in addressing health challenges, and in that spirit, I aim to present a nuanced and insightful reimagining of the article on atherosclerosis. Atherosclerosis Unveiled. Atherosclerosis, at its core, manifests as the gradual buildup of cholesterol plaques within arteries. The culprits behind these plaques are often low-density lipoproteins, LDL, smooth muscle cells, fibrous tissue, and occasionally calcium. As these plaques proliferate along artery walls, they pose a dual threat. Firstly, the narrowing of arteries diminishes blood supply to essential organs, leading to potential damage or cell death. Secondly, the fragile nature of these plaques can result in ruptures, triggering the formation of blood clots that may entirely obstruct blood flow. A global menace. Atherosclerosis stands as a leading cause of mortality and disability, particularly in developed nations like the United States. Its omnipresence is evident in its association with various illnesses, including coronary artery disease, strokes, abdominal pain, bowel infarction, peripheral artery disease, and other vascular conditions. The intricate interplay between atherosclerosis and these health issues underscores the urgency of understanding and addressing this pervasive problem. Unraveling risk factors. Identifying the factors that elevate the risk of atherosclerosis is paramount. These include elevated cholesterol levels, specifically high levels of LDL cholesterol, triglycerides, lipoprotein A, hypertension, diabetes, a familial predisposition to coronary artery disease, smoking, obesity, physical inactivity, and inflammation. Recognizing these risk factors serves as a crucial step in formulating effective preventive strategies. Atherosclerosis in the limelight, recognizing symptoms. Notably, atherosclerosis often operates in stealth, remaining asymptomatic until it significantly compromises organ blood supply. The manifestation of symptoms varies based on the affected organ. Heart. Angina, shortness of breath, sweating, nausea, dizziness, or palpitations. Brain. Dizziness, confusion, weakness or paralysis, sudden numbness, visual disturbances, difficulty walking, and speech impairments. Abdomen. Cramping abdominal pain, potentially escalating to bowel infarction with severe symptoms. Legs. Peripheral artery disease, presenting as cramping pain during exercise, intermittent claudication, or more severe symptoms like rest pain, cold extremities, and potential gangrene. Navigating diagnosis. Diagnosing atherosclerosis necessitates a thorough examination, encompassing medical history, symptoms, and familial predispositions. Assessments may include blood pressure and heart rate measurements, circulation checks, and blood tests to gauge cholesterol levels, triglycerides, and markers of inflammation. Additional diagnostic tools such as electrocardiograms, CT scans, and MRIs may be employed to visualize arterial health. The long road of atherosclerosis. Atherosclerosis is a chronic condition, progressively worsening over decades without interventions. Understanding its prolonged nature emphasizes the need for sustained lifestyle modifications and, when necessary, medical interventions. Proactive prevention. Mitigating atherosclerosis risk involves adopting a lifestyle conducive to healthy circulation. Strategies include smoking cessation, weight management, a diet rich in fruits and vegetables, avoidance of saturated and trans fats, regular exercise, blood pressure control, diabetes management, and periodic cholesterol monitoring. Proactive engagement with these preventive measures empowers individuals to take charge of their vascular health. A therapeutic landscape. While atherosclerosis lacks a definitive cure, effective treatments can decelerate its progression. The primary objective is to prevent significant arterial narrowing, averting organ damage and associated symptoms. Lifestyle modifications form the cornerstone of treatment, supplemented by medications such as statins to manage cholesterol levels. Other medication classes, including ezetimibe, bempedoic acid, and PCSK9 inhibitors, offer diverse approaches to mitigate cardiovascular risk. Tailored approaches for organ-specific treatment. Addressing atherosclerosis-related organ damage mandates tailored interventions. Heart. Medications for symptom management and prevention, along with procedures like balloon angioplasty and coronary artery bypass surgery. Brain. Antiplatelet medications to prevent strokes, potentially coupled with interventions to address narrowed carotid arteries. Abdomen. Interventional options like balloon angioplasty, stents, or arterial bypass grafts for arteries supplying the bowel. Legs. Lifestyle changes, aspirin therapy, and interventions like angioplasty, atherectomy, or bypass grafts for severe arterial narrowing. Seeking professional guidance. Given the latent nature of atherosclerosis, professional consultation is vital upon experiencing related symptoms. Early detection and intervention significantly influence outcomes, underscoring the importance of prompt medical attention. A glimmer of hope in prognosis. Atherosclerosis, while a pervasive threat, no longer carries an inexorable prognosis. Advances in understanding, coupled with proactive lifestyle measures and medical interventions, empower individuals to defy its ominous implications. Despite being a leading cause of cardiovascular disease, individuals with atherosclerosis can lead longer, healthier lives by embracing the pillars of prevention and management. Lifestyle strategies for prevention. Dietary guidelines. 1. Mediterranean diet. Key components. Emphasize the consumption of fruits, vegetables, whole grains, and healthy fats, olive oil, nuts. Moderate intake of fish and poultry, and limited red meat. Benefits. Rich in antioxidants, omega-3 fatty acids, and heart protective compounds. 2. Diet, dietary approaches to stop hypertension. Focus on sodium reduction. Encourage lower sodium intake by prioritizing fresh, whole foods and limiting processed foods. Nutrient-rich choices. Highlight the importance of potassium, calcium, and magnesium-rich foods for blood pressure control. 3. Heart-healthy eating patterns. Plant-based emphasis. Promote plant-based meals, showcasing the benefits of a predominantly vegetarian or vegan diet for cardiovascular health. Fiber intake. Stress the significance of high-fiber foods in reducing cholesterol levels and improving overall heart health. Exercise regimen. 1. Aerobic exercises. Frequency. Recommend at least 150 minutes of moderate intensity aerobic exercise per week or 75 minutes of vigorous intensity exercise. Examples: walking, jogging, swimming, cycling, or aerobic dance. 2. Strength training. Importance. Emphasize the role of strength training in maintaining muscle mass, boosting metabolism, and supporting overall cardiovascular health. Frequency. Suggest 2 or more days of strength training per week. 3. Flexibility exercises. Benefits. Highlight the importance of flexibility exercises in improving joint health and reducing the risk of injuries. Examples: yoga and stretching routines. Stress management techniques. 1. Mindfulness. Mindful breathing. Guide individuals through mindful breathing exercises to promote relaxation and reduce stress. Present moment awareness. Encourage the practice of being fully present in the moment to alleviate anxiety. 2. Meditation. Guided meditation. Provide resources for guided meditation sessions, emphasizing their positive impact on both mental well-being and vascular health. Mind-body connection. Highlight how meditation fosters a strong mind-body connection. 3. Yoga. Stress-relieving poses. Recommend specific yoga poses known for their stress-relieving benefits. Mindful movement. Emphasize the combination of movement and mindfulness in yoga practice. Sleep hygiene. 1. Consistent sleep schedule. Bedtime routine. Encourage a consistent bedtime routine to signal the body that it's time to wind down. Avoiding stimulants. Advise limiting caffeine and electronic devices before bedtime. 2. Comfortable sleep environment. Optimal room conditions. Highlight the importance of a cool, dark, and quiet sleep environment. Comfortable bedding. Stress the role of a comfortable mattress and pillows in promoting quality sleep. 3. Stress reduction before bed. Relaxation techniques. Recommend pre-sleep relaxation techniques, such as reading or gentle stretching, to ease stress. Limiting screen time. Encourage minimizing screen time before bedtime to mitigate the impact of blue light on sleep quality. Recognizing and managing risk factors. Cholesterol education. 1. Understanding cholesterol. LDL, low-density lipoprotein. Explain how LDL is often referred to as bad cholesterol and its role in transporting cholesterol to cells, contributing to plaque buildup in arteries. HDL, high-density lipoprotein. Highlight the role of HDL as good cholesterol, responsible for transporting cholesterol away from the arteries to the liver for elimination. Triglycerides. Explain the function of triglycerides as a form of fat in the blood, emphasizing their impact on cardiovascular health. 2. Managing cholesterol through diet. Heart-healthy foods. Encourage the consumption of foods rich in omega-3 fatty acids, soluble fiber, and plant sterols. Limiting saturated and trans fats. Provide practical tips on reducing the intake of saturated and trans fats, found in processed and fried foods. 3. Exercise for cholesterol management. Aerobic exercise. Emphasize the role of regular aerobic exercise in raising HDL levels and promoting overall cardiovascular health. Strength training. Highlight how strength training contributes to improved cholesterol profiles. 4. Medication options. Statin medications. Provide an overview of statins and their effectiveness in lowering LDL cholesterol. Other medications. Discuss alternative medications, such as bile acid sequestrants or PCSK9 inhibitors, for individuals who may not tolerate or respond well to statins. Blood pressure control. 1. Sodium reduction and diet. Sodium's impact on blood pressure. Explain how excessive salt intake can elevate blood pressure. Diet principles. Detail the diet's focus on reducing sodium while promoting potassium, calcium, and magnesium-rich foods. 2. Medication for blood pressure management. Antihypertensive medications. Outline common classes of blood pressure medications, including ACE inhibitors, beta blockers, diuretics, and calcium channel blockers. Combination therapies. Discuss scenarios where a combination of medications may be necessary for optimal blood pressure control. 3. Lifestyle modifications. Weight management. Emphasize the impact of maintaining a healthy weight on blood pressure regulation. Regular exercise. Reinforce the role of regular physical activity in controlling blood pressure. Diabetes management. 1. Dietary strategies for diabetes. Carbohydrate management. Provide guidance on managing carbohydrate intake to control blood sugar levels. Emphasizing whole foods. Encourage a diet rich in whole grains, fruits, vegetables, lean proteins, and healthy fats. 2. Physical activity and diabetes. Benefits of exercise. Highlight how regular exercise improves insulin sensitivity and aids in blood sugar control. Tailoring exercise plans. Discuss the importance of customizing exercise routines based on individual fitness levels and health conditions. 3. Medication adherence. Oral medications and insulin. Provide information on various oral medications and insulin therapies commonly used in diabetes management. Importance of adherence. Stress the critical role of medication adherence in preventing complications associated with diabetes. The role of genetics in atherosclerosis. Genetic risk assessment. 1. Understanding genetic factors. Familial predisposition. Explain how a family history of cardiovascular diseases can indicate a genetic predisposition to atherosclerosis. Polygenic nature. Emphasize that atherosclerosis is often polygenic, involving the interplay of multiple genetic factors. 2. Identifying individuals at risk. Family history assessment. Encourage individuals to gather detailed information about cardiovascular diseases within their family, considering both immediate and extended relatives. Recognizing patterns. Discuss common patterns, such as early onset of heart disease, strokes, or the prevalence of high cholesterol within families. 3. Genetic testing guidance. Who should consider testing? Provide insights into individuals who may benefit from genetic testing, especially those with a strong family history of atherosclerosis-related conditions. Benefits and limitations. Discuss the potential benefits of genetic testing, such as early detection and personalized risk assessment, while acknowledging the limitations and ethical considerations. 4. Types of genetic tests. Single nucleotide polymorphisms, SNPs. Explain how SNPs can be indicative of genetic variations associated with atherosclerosis risk. Sequencing techniques. Briefly touch on advanced sequencing techniques that can provide a more comprehensive view of genetic predispositions. 5. Counseling and decision-making. Genetic counseling. Advocate for the importance of genetic counseling before and after testing, ensuring individuals comprehend the implications of their genetic results. Informed decision-making. Encourage individuals to weigh the potential benefits and psychological impact of genetic testing, making informed decisions based on their personal circumstances. 6. Lifestyle modifications based on genetic insights. Tailored preventive measures. Discuss how genetic information can inform personalized lifestyle modifications, such as more aggressive risk factor management for those with high genetic susceptibility. Empowering personalized health. Emphasize that genetic information, when used judiciously, can empower individuals to take proactive measures in their cardiovascular health. 7. Ethical considerations. Privacy and confidentiality. Highlight the importance of privacy and confidentiality in genetic testing, emphasizing that individuals have control over who accesses their genetic information. Impact on family dynamics. Discuss potential familial and psychological implications, encouraging open communication within families undergoing genetic testing. Conclusion: empowering health through knowledge. In the intricate tapestry of cardiovascular health, understanding and addressing atherosclerosis is pivotal. As we navigate the complexities of this pervasive condition, education emerges as a beacon of empowerment, guiding individuals toward proactive measures and informed choices. In conclusion, atherosclerosis, once perceived as an inexorable threat, now bows to the power of knowledge and proactive health measures. As a professor committed to unraveling the mysteries of medical science, I extend an invitation to embrace education, awareness, and a personalized approach in the pursuit of vascular health. Together, we can turn the tide against atherosclerosis, fostering longer, healthier lives and a future free from its ominous shadows. Your health matters. Quali.health